you guys doing?
We're doing fine.
We're doing well, thank you. Thanks for coming on.
Yes, thanks so much for coming on. Everybody, we have Dr. Sherry here, and we're so happy to have her here because she has the answer to so many questions and can help us out so much. You are located in Santa Monica, but she's also the author of SHE-OLOGY and SHE-OLOGY. The sequel, it's awesome. Yes, they're great books. And we have just a lot of people that have asked a lot of questions about just how to deal right now with hot flashes and all kinds of
natural alternatives.
Yes, all kinds of issues to go around menopause and perimenopause. We've been writing down questions that people have been sending us. So, we really just thought it'd be great to have you live. And if people wanted to post questions, they could as well. So anything else you want to add, Colleen?
Just, you have 30 years of experience. You've seen everything between delivering babies and women going through menopause. What are the most common complaints you get from women who are just starting that perimenopause journey?
I would have to say irregular periods are probably the most common. No kind of noticeable symptom. But the truth is, perimenopause, you can have mood changes, depression, you feel more depressed, you feel low energy, you notice it's harder to lose weight. I mean, there's just sort of a lot of similar symptoms. And they're all disruptive. Weight gain, mood swings. It's you want to kill your partner or strangle your child. So it's just sort of the tip of the iceberg.
Mm-hmm. A lot of women are looking for a more natural alternative. They're afraid of HRTs. They've heard of the reports, whether they're true or not, and they just want to try some alternatives. So what do you start with when someone says, I really want to go the natural approach with perimenopause?
So usually, is it affecting their sleep? Is it affecting their ability to work, to sort of function, to be, doing the normal routines? And when it gets to that point, I'll say, well, what about diet? What about exercise? Because we know exercise, with the feel-good hormones, there's just something, you feel good. It does help. Certainly diet and really eating a more Mediterranean-based, plant-based, more fruits, vegetables, healthy fats. This all makes you feel better and more energetic. I always think it's better to sort of dip the toe first. And then, in general, these are changes that are a lifetime. So let's make it so women are eating better, exercising, getting a good amount of sleep. But when all else fails, then what? I think acupuncture, people that specialize in women's health, and there are many, some do infertility, some help with depression, but there are that work well for hormonal disruption. So we sort of start at what seems more practical. Then we, HRT, estrogen, the pill, we know that's going to work, but not everybody sort of wants to take that route. So that's really how the supplements that I created in SHE-OLOGY were made, because, it dawned on me, women want alternatives. They want something that's going to work. If it doesn't work, what's the point? And so I searched high and low, and I said, what can I tell someone to take that may help with hot flashes and, insomnia, heart palpitations, depression, anxiety, without going on Prozac or Valium? What else could we do? And and the journey of finding the right combination of herbs, sort of Chicago for the Menopause Society. And, us doctors, we're very scientific, and everything has to be randomized, double-blinded, and unbiased. So there was a poster, which are sort of like a small study that you can learn about. It's sort of off the beaten path of the main lecture hall, but it's it caught my eye because they did a study of passion flower extract. Mm-hmm. And I'm like, I've never heard of it. And this was in 2014. And they did a great study where they found that women in menopause mainly that had all what we call vasomotor. Vasomotor is just a fancy medical word for the hot flashes and night sweats and the feeling of heat and panic attacks where you feel your heart racing and it's uncomfortable, and a particular herb helped those symptoms. And they went as far to say that this herb could be used for breast cancer patients, which was kind of cool because breast cancer patients, they don't have a lot of options, right? They don't have, they can't even have the estrogen conversation. So, what herbs could we put together with, our hero herb was passion flower extract. In fact, that's in all three of the supplements that I created that were going to work. And sort of the search began, that was one of them, but that was sort of the way, I like to have the conversation with women. We sort of go through, let's look at our lifestyle, then let's look at, what are you comfortable doing? Because you sort of have to do it regularly. You don't just go through it. You really don't go through menopause. You're going into the eye of the storm, and what can you do?
Yeah, that's interesting that, you were talking about the breast cancer patients and how that, this is such an option because they're so limited. And we actually had somebody ask us, she's 71 years old and she had surgical menopause and due to cancer. And she said the doctor doesn't want her near any hormones, not even I guess maybe even phytoestrogen. She said plant-based, so I don't know if she means phytoestrogens or just different supplements. And she still has hot flashes at 71. And she was just like, what can we do?
Yeah.
So could this be a good option for her?
Yeah, I mean, it's a great option for her. And it's funny. I mean, I have women in their 80s that are, dying for their estrogen. Please give me the refill. I really need it. Because they need it. I mean, you turn off the estrogen when you hit menopause at 51 on average, all of a sudden you're like, wow, I didn't realize all these symptoms were associated with one, particular hormone, but it is sort of our superpower hormone that gives us it feminizes us, just like testosterone is for men. But passion flower extract is a great alternative for you. I mean, certainly if it's just hot flashes, but, we also know anxiety and depression, and, we're looking at ashwagandha and royal jelly and chromium, because weight gain is huge. Like that is the curse of death for most of us, the weight gain. And there's a lot of science behind the why, why it happens, and has nothing to do with taking. Do you get a lot of complaints about women and weight gain?
Oh
yes, we did.
Me personally,
we did a live. Both of us. We did a live stream recently. We had about 1,300 people watch it on weight gain. So it is a common problem, a common complaint for women in midlife. Can you talk a little bit about the connection between perimenopause and weight gain?
Sure. Well, it's, here's the thing. As we age, we gain weight. And whether that's starting in your 40s, we sort of know it really takes off in your 50s, but it does start to happen in your 40s. So that's just one factor, but the association of the changing of estrogen, the decreasing of estrogen has a profound effect on our muscle mass too. So we sort of have less muscle mass, which helps burn fat, and so less muscle mass, more fat. And then of course, estrogen and the changes associated with, lower estrogen, we actually have to eat less by about 40 to 70 calories a day to keep up with our sort of our normal weight gain. So it's sort of like we have aging, we have the decrease of estrogen, and And then, of course, we have sort of the metabolic effect of estrogen on the metabolism. So it also sort of creates, this certain issue of, we just have a hard time losing weight. One of the ingredients that I really like in our product is called chromium. And it's been well studied. Yes, it sort of helps with things, as it relates to depression and mainly depression, but weight loss is one of the ones that it really does help with. We know it kind of helps with stabilizing blood sugar. Diabetics get some, good relief from it as well. So it's, one of the ingredients that I think does help in this, sort of process of, what can we do? Yes, you have to look at your diet. I mean, you just have to, and you have to be exercising. These are just musts, not just for, the weight issues, but heart disease. I mean, ladies, 1 of 4 will die from heart disease. So when you hit 50, late 40s, mid 40s, you're really never too young to start changing and really focusing on, what can I do to sort of prevent illness down the road, feel good about my body, not gain a ton of weight, and deal with the symptoms of menopause.
What about black cohosh? We've heard a lot of good things and bad things about black cohosh. Can you talk about that?
Yeah. So, black cohosh was sort of the one we always heard about, black cohosh. So basically, it acted like estrogen. It was a plant-based product. What I learned when I was doing a lot of research about what ingredients to add, black cohosh was one that had a sort of a big, circle / no on it, because it's not been well studied. They don't know what it does in our bodies. So, and the studies were inconsistent of how it worked. When you have an ingredient like passion flower extract, that is just, the leader of the class, it really works. There's science behind it. It's like, why use sort of what, we call Chinese herbs that have traditionally been told to us to use, but there was really no science behind it. So, one, I wouldn't want to put people in danger when they take it. And 2, it really didn't work. It didn't work as well. I mean, there's just so many other ingredients that have science behind it. I keep going back to science because it's so important. Just because they're herbs and they're supplements and there's no prescription behind it, you're ingesting them. And it's something you're taking every day to feel good about. So you just have to be really careful about products you're getting, where they're manufactured. What do you know about the company that you're purchasing them from? Because there's poor regulation in the FDA world with supplements. It's kind of the wild, wild west. I mean, you guys could do a supplement called, Hot Flashes and Cool Topics. I don't want to give any ideas here, but you could, and slap a label on it and away you go. And sadly, that's what happens. Products are coming from all over the world. You don't know where they're coming from. You just have to be suspicious always about supplements. And that's sort of another issue that I really, realized when I was going through the process. It's great when it's made in the U.S. with herbs too. And I don't know if you both know, but your supplement is only as good as where it's made.
Yeah.
So the manufacturer is really has a lot to live up to and a lot of credentials, excuse me, that they have to live up to. And that's where the, sort of checks and balances lie, is where they're produced and manufactured and all the, regulations that they have to go through. So, the SHE-OLOGY supplement line, we made it in San Diego. We have also a manufacturer in Texas, but, where are you sourcing the ingredients? How are those ingredients being analyzed? Because, here's your batch. It's like you're making a cookie batter, and then you make the product. But after all the supplements are made, there's, really they take out the first fresh batch, and they assess them to make sure that what's on the label in doses is actually in the contents of the pills. So it's really, really important to know that when you're, at GNC or, at Amazon, what you're buying.
What you're looking for. We have somebody popped up some.
And the other really cool thing about.
Oh, go ahead. Yeah.
Yeah.
I think she was breaking up there for a second.
Oh, am I? Oh, okay.
Bridget, no, I think that Dr. Sherry broke up there for a
okay.
second. Dr. Sherry, we had somebody pull up and say that they had a hysterectomy about 5 weeks ago, and they wanted to know when the bloated belly would drop down after hysterectomy.
I wonder if the ovaries were removed or not.
She kept her ovaries.
Okay, so that's good. So she probably just had bloating as it relates to, the change of removing an organ out of your body. And I don't know how it was done, if it was done through the robot or incision, but it's usually about 6 weeks to 3 months to adjust, because oftentimes you've had the surgery, you're on pain meds, which of course constipate you. And that's kind of hard because all of a sudden, you can't have a bowel movement for a couple of weeks, or it's hard to have a bowel movement. So these are all the things that can happen that are challenging.
Yeah, that's interesting. I didn't know about that. Yeah. Oh, go ahead.
Yeah. So it's good she didn't take out her ovaries, because then that would have been another, roller coaster. Going into surgical menopause is just not fun.
Okay. So that's probably what that woman that was 49 went into surgical menopause. Because I was going to ask you the reasoning for the ovaries, but is it usually a cancer, or I didn't know what that.
No, I mean, the thing, it used to be if like you're over 45, we'd recommend taking out the ovaries because you're close to 50, 51's the average age of menopause. But women don't like to part with those ovaries. They like to keep they like to keep them. And I think the argument is, if you're 51 or 50 and you're in menopause and someone's going into your abdomen to do another surgery for, whatever it is for the uterus, I would take them out, because they're just there to cause trouble. They're just there to cause trouble. Once you're done with menopause, done producing estrogen, they just kind of hang out, and you worry about different issues related to cysts and ovarian cancer. So I don't know, over 50, I say remove them. But again, some women aren't really ready to part with their ovaries.
Okay.
Another question we have had a lot from women is. Go ahead.
No, I was just going to say, the women that went into surgical menopause, what I like to do, if anyone that's thinking about having a hysterectomy and taking out the ovaries, is usually you get on, you check your estrogen levels or your FSH, right? Your FSH hormone is the most sensitive marker to diagnosing menopause. So you get that done, before you get the hysterectomy, usually a month before. And then if it's in menopausal range, you can start taking estrogen, or start taking a passion flower extract, or taking SHE-OLOGY menopause, so that you are prepared when you go into surgery. It's not like this horrible thing, because you take out the ovaries, it's like a quick turn off of estrogen, and it's a tough one. The hot flashes, the feeling like you want to crawl out of your skin, really can be dramatic.
I was going to ask you before, with excessive bleeding, a lot of women complain that when they're coming close to the actual menopausal date, their periods get irregular and they have excessive bleeding. And some women have gone for the ablation. What do you recommend for women who are having the excessive bleeding?
Yeah. Well, it can be really disruptive. Now, the definition of menopause is no period for 1 year, right? But as you get closer to that, the ovaries just, they're basically freaking out. They're not functioning normally. So you can have periods every 2 weeks, which is not so great, or you could bleed for 2 weeks with blood clots, and it can be very, very disruptive. You know, we attempt, because you sort of have a choice of medically treating it with, let's say, progesterone. That's like the most gentle, where you take progesterone 10 days a month. You can go on the birth control pill, which regulates it beautifully. Those are sort of the two best options. An IUD with progesterone is a great another way to control bleeding. You know, then if that doesn't work, or you want it to happen faster, you can do the ablation. I am a huge fan of the surgical ablation. My favorite is with water. There's a few different types, but the hydro, which is water, hydrothermal ablation can solve your problems really, you know, in a 1 hour procedure as an outpatient. And it sort of boils the inside of the uterus and stops the bleeding in a really nice way, because you just don't know how long is that bleeding going to last.
Mm-hmm.
Right.
Yeah.
And then you could become anemic, and not everybody can take iron. So it's kind of a snowball effect.
Mm-hmm.
Yeah.
When you were looking at the natural ingredients to go in, I know you talked about passion flower extract.
Yeah.
Can you talk a little bit about, like, you included things like chasteberry fruit extract? I have no idea what that is. Or ginkgo biloba.
Yeah.
How did you choose the natural ingredients that you felt were important for hot flashes, for sleep problems?
Yeah. You know, it was all based on the science.
Mm-hmm.
Again, you know, it was very thoughtfully done. Chasteberry and royal jelly have been very well studied for PMS.
Mm-hmm.
You know, from breast tenderness to moody changes. These have been around for a long time and have worked very well, again, through the studies that I have found to be effective. So, you know, we sort of looked at, you know, in my mind, like, well, what are women's worst symptoms? You know, if we're talking about peri-menopause, or we can even talk about PMS, you know, it's going to be the mood swings and, you know, fatigue and crying and bloating and feeling very tired and depression, right? So you look at the symptoms and they're like, well, and cramps, of course, can also be a part of it. You know, what can we do to treat all that? What ingredients can we, you know, handpick that has been studied to show it's going to help you? And that's how it was. So, you know, if you're looking at all these symptoms together and you're looking at chasteberry and passion flower extract, royal jelly, ashwagandha, you know, we're looking at ashwagandha is great for anxiety and depression, right? It works really, really well. We're looking again, you know, chromium, passion flower extract are going to be helpful, and folic acid is also going to be helpful. So these are just things, of course, calcium, magnesium, and the B vitamins work well. So we're like, well, let's put it together. You know, Co-Science, Bruce Thompson, who's the biochemist and CEO of Co-Science, you know, we work together to be like, well, let's really create a product that doesn't exist. You know, some of the competitors, they only have passion flower extract.
Okay.
That's it. Or they have passion, you know, they may have chromium or royal jelly, chasteberry only. But there's so many other ingredients that you can add.
And everything's safe together. Everything is safe together.
Why not add them? And then let's make a multivitamin as well. Let's really make it all you need. So, you know, and 2,000 units of vitamin D are in the multivitamin. So it's like, well, why not make it easy for women? Like, you don't need tons of vitamins. You know, we want you to get it through your diet. You know, you don't need to overdo it, because if you overdo vitamins, you end up urinating a lot of them out, right?
Yeah.
Stimulation. And make it easy for women. Like, I've done my homework for you. I'm going to make it easy. You don't want to, Valium or Diazide or, or if even, we'll try it.
Mm-hmm.
I think for the herbs to really work. But how great, you got your multi, you got the targeted ingredients for our hormonal cycles, PMS, peri-menopause, and menopause that have science behind it. And, you can try it. And that was sort of the whole idea, prescription alternative for the SHE-OLOGY product line that we're really excited about.
Mm-hmm.
What about B12? We hear a lot about the importance of vitamin B12. Can you talk a little bit about that?
Yeah. So vitamin B12, if you go to Lindora, you're getting a vitamin B12 on your backside, right? Because it's going to help you lose weight. There's really no science behind it. Zero. Unless you're deficient.
Okay.
Unless you're deficient in B12, you're not going to really get much benefit from it as it relates to weight gain. And so it's sort of, when it comes to weight gain, we're all, we all want that magic pill, right? Who doesn't?
Right.
You're willing to take a shot at your tush. But what I find, too, is a lot of women are overdoing it with their vitamin B12. Some women will come in like, hey, I want a vitamin B12 shot. I'm like, well, let's check your B12 first, because they get it at, the doctor down the street or their nutritionist. But, I feel it's so important that we just educate women and, give them the right information and not make them feel like, this is really going to work. And I think with vitamins, it's hard, because there's so much misinformation out there in the marketing space that really misleads women. And I, as a women's health educator, I just feel like it's our responsibility to really be out there, educate, and not really think that this is going to be helpful. And I think with weight changes and weight gain, it's frustrating. You're willing to try almost anything. But B12, ladies, just get your level checked before you start getting injections.
Okay, that's good to know.
That's great. Because you don't want to waste your money if you don't have to.
You don't want too much B12 either.
Right.
So.
Absolutely. Yeah.
Yeah. I mean, like B6, vitamin B6, we use it a lot for PMS because it does help with, headaches and dizziness and depression, and some of the symptoms that are actually really common to that cycle.
Okay. Mm-hmm.
That's hormonal cycle, irritability, and things like that.
Yeah, we had
So it's. I think if you want to be on any of the Bs, B6 is my sort of favorite.
Okay.
That's good to know because most people think B12.
Yeah, and we got it's funny, or not. I always say it's funny and it's not funny. I mean to say it's a coincidence and I end up saying, oh, that's funny when it's never funny. But this woman wrote in, she's only 34 and she was like, oh, I have these strong symptoms. I'm angry. I have no patience. I can't sleep. And I was like, you sound like, that sounds like PMS. You're 34, right. But you do have a product for PMS as well. Our SHE-OLOGY has a product for PMS as well. And you were talking about that.
Yeah.
In there because I've got my little pamphlet.
Yeah.
And I've got my things. Yeah. So I've got my stuff here, but you've got in the pamphlets, you have all kinds of things, but there is the PMS one. Yeah. I'll hold that up.
So it's, it is. And it's funny that PMS, the B6 magnesium actually helps with food cravings and calcium too helps with food cravings. So
Mhm.
when you look at what vitamins have been sort of traditionally looked at for PMS, because if most people go to the doctor, the gynecologist for, they're like, well, I have, maybe some, I don't feel as more emotional, or I headaches, and I feel fatigued, I feel bloated before your period, and then it all goes away. So, there were actually over 400 symptoms associated with PMS.
Wow.
And so it was important for our PMS product. And the nice thing about you ladies is you're talking to women about really hormonal cycle disruption, peri-menopause, sweeping into menopause, but how great to also talk about PMS, because sometimes it's hard to tell there's a difference between PMS and perimenopause. Like, it's hard to tell.
Yeah.
So, but a lot of the ingredients overlap. In all of them, an issue with dry skin, dry skin and problems related to wrinkling and blemishes and things like that. So we started to look at some of the collagen containing ingredients, and the collagen containing ingredients we added into it for hair, well, more skin, skin changes and wrinkles, and kinetine is one of them, and collective low molecular weight collagen, and things that do help. And with almost anti-aging, and fenugreek is another really great ingredient of anxiety. So there's a lot of overlap of like all these ingredients collectively. We did add the one that, sort of you mentioned earlier, black cohosh, ginkgo biloba. That's another one. Like I sort of remember hearing about it when I was, looking into this, and it was one of the first ones, like, well, what's the science? I was like, what's the science? And it did sort of show itself as helping with anxiety and memory changes, and sort of more cognitive. Because as we get older, we're like, oh my God, where did I put the keys? Or did I lock the door? Did I put the alarm on? Did I lock the door? Like, did I close the door? It's like, so we have to look at some of the antioxidants too, omega-3 and things like that are helpful for anti-aging. Little things that are going to be helpful, but these are some of them. So I'm really proud of the menopause formulation, because I think, and what I've seen, we're doing a study, because we have to, as scientists, we have to see if it's working. I don't want, I want to make, I know it works on paper, but now we're giving it to women. And I will say this, one of the issues that I have with pills in general, I'm not a really good pill taker, because I don't really remember, but these pills, so it is 6 servings a day, but I will say this, so you can take 3 at a time, no problem, because they're little capsules and they're very easy to swallow.
Right. Okay.
Very easy.
I have none right here. Yeah.
And I just do it, in the morning. Yeah. When you get up, you take 3, and then before I go to bed, I take 3, and it's very easy to take, and you sort of have to take it.
Right.
Reason we had to break it up, the reason, like, we could have made one big bullet.
Yeah.
But it would be hard on your stomach.
Okay.
Yeah. And a lot of women have sensitive.
We're sensitive to that. So,
yes.
We want. Oh yeah, right. None of us I can't eat milk products, dairy, or anything like that. So it was very purposeful. We really were targeting the symptoms, disruptive symptoms. We wanted to help with aging and wrinkling and some of the blemishes that you get, and memory and things of that sort, and a multivitamin with 2,000 units of vitamin D. So it's all put into this formulation that we're really proud of. And, you know, whether you're in your 40s, 30s, 40s, or 50s, with any hormonal symptom, you're gonna feel better and you know, become your most vibrant self is our tagline for a reason. Because we get better as we age, right? We get better.
We have freedoms. We have,
so
and
we
it's so
want to
nice
help
to
each
have,
other, and, you know, really do what we can.
There are women that say they start getting frequent UTIs when they're going through menopause. What are the natural ingredients that can kind of address whether it's dryness, vaginal dryness, or the UTIs?
Yeah, that's a great question. It's a very common problem. So when you turn off the estrogen, you know, the vagina gets very dry. It gets dry because estrogen is kind of like the watering tissue becomes pale, dry, and sometimes, you know, and the bladder sits right in that area on top of the vagina anteriorly, women feel pressure. They feel like, oh, I have to pee. Or they have urgency where they pee, they have to go pee and only a little comes out. And sometimes it's very hard to tell the difference between a UTI or just vaginal dryness symptoms, which we call, you know, vaginal atrophy, atrophic vaginitis, the medical term. It's one of those things that you really have to hydrate the vagina inside. It's very, very important because it's progressive. So it's usually the first year, 2 years, it's about hot flashes and emotional changes. You're not thinking about the vagina yet, but 4 years, 5 years later, all of a sudden you're thinking about the vagina. And then if you're having any sexual contact, whether you're having vaginal penetration or anything else going inside the vagina, it's painful. So what you can do, and I think every woman should do starting at age 50, even in their 40s. I mean, I think hydrating inside the vagina is very important. You know, I always say we have to take care of our vulva and our vagina like we do our face. Like we hydrate, we moisturize, we use special products that are helpful for against aging. And you have to think of it the same way. In fact, I'm going to I have a product line called SHE Intimates that here all the time. That what can we do inside and outside to keep the tissue moist, hydrated, because that prevents dryness and itching, right? So these are things that we all have to do on the outside. I recommend extra virgin coconut oil, whether it's in your bathtub, a big handful, dump into the bath, or in a shower, you can rub it on. And I trying to make ingredients that won't disrupt the pH balance, because the vagina and vulva are very sensitive to ingredients that are not natural, that have fragrance. So when you make products, specific for this area, you have to be really mindful of that. And there are ingredients that are lovely, and I'm really excited about this SHE beauty line. It just worked. The patient of mine was telling me about this new line of skincare that was very natural, clean beauty. It's so important, clean beauty, which no additives, nothing that you make up in a lab that you're putting all over your body. Well, let's do it for the vagina and vulva. Now, inside the vagina, I'm a big fan of hyaluronic acid. You can get it in different formulations, but to someone that's getting frequent bladder infections or the feeling of bladder infections, the first thing, you will check your urine. Of course, you should always, if you feel any symptoms, always drop a urine off at your doctor's first. If it's positive for E. coli, which is the most common bacteria in urine, then, we treat you with antibiotic. But if it's negative, then you start thinking, well, wait a second, do I need to really hydrate inside? Do I have other conditions? as it relates to interstitial cystitis. They did a great study looking at vaginal estrogen compared to hyaluronic acid, and for women in menopause to see what kind of relief they got, and the results were the same. You don't need estrogen in the vagina to achieve comfort. So hyaluronic acid vaginally was another, like, well, this makes a lot of sense. So the sooner all of us get into the routine of taking care of our bodies early, on the right products that are, vagina friendly, vulvar friendly, that are more specific for the vagina, that won't disrupt, cause a yeast infection, or cause itching or dryness, the better it ages. The tissue, there's less itching and chronic scratching and, pain with intercourse.
Yeah, we've had, well, I just know, like, as you get older.
I could talk all day on this topic.
Yeah, I know. Well, I know, like, when my mother was older,
right,
she would get frequent bladder infections, and that could really wreak havoc on someone like in their 80s. And so it's so interesting just talking about when you get started younger. But we have some people that have written in some things.
I don't know what agnus castus is. Do you know what that is?
Yeah, no, I don't. Like, I was reading that. Yeah, I've seen somebody say that.
Somebody asked about royal jelly, the chasteberry, but she also wrote about
ashwagandha.
Not ashwagandha. No, she actually says AGNUSCASTUS.
Yeah. And
perhaps that's her name. I don't know.
Well, no, she said she.
Oh, it's Katerina. Okay.
Since
Peri started, I'll look into it.
Oh, okay. Yeah. She said I was just reading, she was more sensitive to heat and sun. She started getting heat rashes only on her arms and chest. Now, 3 years later, she's super sensitive to the sun. In showers and sweat, she gets sun rashes.
So she wants to know if it's a symptom of lower estrogen.
Oh, okay. Yeah.
Like sunburning, skin. I know skin irritation, like itchiness. Itchy can be that.
Yeah, I mean, not necessarily skin irritation, but if she's having hot flashes, things that bring on a hot flash. I mean, maybe for her, the sun could bring on it. Certainly spicy foods and red wine and things that bring on, trigger the hot flash. So it may be that for her, it's skin sensitivity, because I wouldn't discount any of these symptoms not being related to low estrogen. And some women are just more sensitive than others.
Because she asked that, is it due to my lack of estrogen or something else related to peri? Yeah.
And if she's very light skinned, it's very possible.
Yeah, she said she's from the Mediterranean and hadn't had the problem before.
So she was recommended hydrocortisone cream.
Yeah.
Well, that's, I mean, I'd rather treat the symptom. She's, hydrocortisone is good for rash and itching, but, maybe she should try some SHE-OLOGY peri-menopause or menopause for getting rid of the symptoms, and then she would not need to use hydrocortisone. Like that's treating the symptom, but let's really treat the cause.
Right. Okay.
And she said she's not drinking any alcohol and coffee. So she's like, really,
Not even during COVID, huh?
Wow, I know. Which brings me to your Immune Strong product. So, which I'm trying to hold it in front of my camera. So can you talk a little bit about your Immune Strong product?
Yeah, well, that's actually a Co-Science product.
Oh, okay, gotcha.
Exactly.
Okay,
yeah,
okay, I got it. Oh, I see. It's Co-Science.
Yeah.
Okay, I got it in my box.
It's basically vitamin D.
Okay.
And yeah, no, I mean, we can talk about it. I mean, it's what's great about it, and this is something people have to know, is with COVID, they were looking at vitamin D. I mean, they're looking at a lot of things that, if there are things you can do very easily, and one happens to be boosting your vitamin D, because most of us are deficient in D or have low levels. And they found that people who had normal levels or higher levels, had less sort of bad outcomes as it relates to COVID. So immune strong is really that. It's a simple way of boosting up your vitamin D levels.
Okay. Okay.
We've also heard that lower estrogen.
So I think,
yeah. No, I was going to ask you about lower. I read something that lower estrogen can be risky for COVID as well. Is that true?
I haven't heard that, but it may relate to older women are more at risk. So, maybe this could be the cause. I mean, I think it's, after 50, we're just more at risk for things, whether it's diabetes or heart disease or high blood pressure or high cholesterol, and this is part of it. And I'm going to take it a step further, obesity, and since we have an obesity pandemic going on, all these variables, which women over 50 and in menopause, which we sort of are prone to as it relates to weight gain and estrogen, puts us all at high risk. So you could probably take it a step further and say, well, these women also have low estrogen. So I think, yeah.
It's all kind of part of the package. Yeah, yeah.
I noticed also that sage was not like what I've heard good and bad things like I did about black cohosh also was sage. That is not included in SHE-OLOGY products, correct?
Yeah, no, I haven't seen studies to show. I mean, give me sage to sweep a room and get rid of all the
the stuff in there.
Yeah. And I like it in certain foods, but I haven't seen studies to show benefits as it related to menopause and perimenopause. So I'd have to look at that. Again, it's sort of we're very careful about every ingredient, and if you look on the website, I have a whole section on the science because I want to not, I'm telling you they're science backed, and I don't want you to believe me until you to read it and look at it, convince yourself that, this is going to actually help me. And it was important to show it that way. But sage, I want you to send me the other spelling of that other herb so I can look it up and also look up sage because I'm always curious about that.
What ingredients also help the natural ingredients included for migraines? Because as someone who suffers from hormonal migraines, I'm still in peri forever. The migraines get really bad. So I know that magnesium can be helpful, but what else in there would be helpful?
Yeah. Magnesium, fenugreek is another one that we like to use for. It's tricky because migraines are hard, and there's a hormonal effect, the shifting of hormones, and I think it's hard sometimes to know, and maybe none of these are going to help. But if you think about it, whether it's ashwagandha that helps with anxiety and relaxation, that if headaches and migraines are worse when you're feeling anxious, this has a relaxing effect. And then you start taking things like fenugreek that can be helpful for headaches and magnesium. But it's tricky. A lot of women do get better in menopause when they don't have any more periods.
Mm-hmm.
Oh, something to look forward to.
I always think too. It's always
I don't get them as often. Yeah,
doctor.
I don't. Mm-hmm.
I also noticed that you have CoQ10.
Yeah, I mean, sometimes. CoQ10. CoQ10 is just a great antioxidant. It's just. Well, yeah, I mean, it also is. I mean, I wish there were more studies to look at sort of what it did for, sort of the bad cholesterol. But it's, we do know, they always say, yes, try to get it through your diet because it's really, good for you. It's good for your cells and your body to be taking, CoQ10. But it's, it's looking at everything together to sort of see the benefit of it all.
Mhm. Mhm.
And it's really, you want to try to do things for heart health and blood pressure and things like that. And a lot of these antioxidants are helpful for that. And, they looked at depression and anxiety with CoQ10. I mean, there's some things that it may be helpful for. And those are some of them.
If someone is looking into, excuse me, the natural supplements, and I know we spoke before about this off air, but if they're on HRTs, like Bridget is on bioidenticals, and she would be interested in maybe going off to go on something more natural, how do they switch?
Again, there's no studies to sort of show this particular question. What I usually tell patients is I would take them together for 2 months, and then you wean off HRT, or you go the other way to do it is to stay on it 1 month, and then the second month you wean off HRT. You never want to stop it cold turkey, because I think that's harder. So if you're doing the patch and you're doing it every 3 days, I always tell patients cut it in half and use it for 2 weeks like that. And then just the third week, just use one patch a week and see. Because by then, the third, fourth week of their second month, these herbs should be taking effect.
Okay. That's a good
And
question.
that was my next question. How long until you start to see the benefits of taking all these natural supplements and vitamins together?
I would say 2 months. I would say 2 months is really the sweet spot. Take them. I think they're very, it sort of has to get into your system. And I think, give it 2 months. If it doesn't work, then it may not be for you. But I find that people are taking it as directed, 3 in the morning and 3 at night, consistently. We've seen some really good results with our studies so far. So I'm hopeful that, you will see a result and you're going to feel better. And that's our goal.
Okay.
And you have some products that you were talking about that are going to be coming out for your libido, correct?
Yeah. We're so excited. So Focus on Desire is another, again, it's one of those that ingredients have been very well studied, looking at what is really our big issue, right? What's our issue as it relates to low sex drive is desire. I mean, yes, it does, there's less blood flow, harder to have an orgasm, right? All these things that are terrible. They looked at L-arginine, L-citrulline, and they looked at pine bark extract in rose hips. There was a big study done. And again, it showed that these women actually had an increase of their sexual function and enjoyment and physical arousal with these 4 ingredients.
Wow.
So better orgasm as a result, function, arousal, and orgasm. It was kind of like, wow, this is really another science-backed study to show it helps. Add ashwagandha for anxiety and ease of stress. And again, another great thing. And fenugreek was the other important one that's also been studied that helps with sexual desire. So these were sort of the main ingredients, the 6 main ingredients that, help with improving sexual wellness, which is, hard. We don't have what men have. We don't have all the things that they have in the little blue pills, and we work differently. For us, if 40 million women, almost 40% of women have low sex drive, that's a lot of women. And it has to do, this is about desire. So what can we do? I mean, assuming you like your partner, that's always the first question I'm asked. You still like that person?
That would be helpful.
If the answer is no, I'm like, well, that's probably the first problem. But if you do, and if you want to improve it, we're very excited to have this. We have it for her, Focus on Desire for her, Focus on Desire for him. Because men also have a low desire. I mean, it's not just about the erection, it's, there is a little bit behind that. they go through menopause, right?
Yeah.
They go through menopause.
Mhm.
So
Mm-hmm.
very excited. And we're also looking at one for weight gain,
Oh,
Okay.
that would be
that helps with
fantastic.
weight loss.
Yes.
That would be a popular one if you
Oh,
did.
that will be. The lady wrote in, she said that that ingredient, that Agnes castus, is the Latin name for chasteberry.
Oh, okay. So it's chasteberry.
Oh, chasteberry.
Yes, that's so
Yeah.
she said it was the Latin name for that. Mm-hmm.
Well, there you go. Okay.
Maybe I should have known the Latin name. Now I'm feeling a little bad about it.
That's okay. See, you learned something on the show, so you never know.
She's gone on to bed. She said it's 1 a.m. in the south of France.
Yeah, that's a great ingredient. And it's one, it just helps with so many symptoms, from mood changes to irritability to weight, blood sugar stability and things of that sort, and hot flashes, insomnia. I mean, it's almost as good as passion flower extract. They sort of battle 1-to-1, but they're very good ingredients. They're in all 3 of our products too.
Oh, okay. Okay.
It sounds like we keep coming back to the passion flower extract as being.
It does. That sounds like something. Yeah.
Yeah.
It's sort of like there's a few, like I don't want it to be like Sophie's Choice. I have to pick, because passion flower extract, chasteberry, royal jelly, chromium, ashwagandha. I mean, there's so many that target women, and they're bound to feel better as a result.
Which is awesome. And I also like the fact that, on your website for SHE-OLOGY products, you list every single natural product on there. So people can do their research. They can look to see what the ingredients are. And then if they have a question, you have an Ask Dr. Sherry area where they can actually ask you a question and you'll get back to them, which is great, because a lot of times people are concerned about taking things.
Yeah, no. I really want it to be a place, community feeling. And there's tons of question and answers and common questions people ask me. You can, write in, you can read about all the ingredients we've talked about. I go into a little explanation about each of them in the glossary. There's the science with all the studies. Yeah, I mean, I wanted to feel like, you know the product, who's behind it. Or I could just come on this show weekly. We can talk too. But, I wanted to be
okay.
I can to be available.
Thank you.
That's fantastic. Yes.
You're always there when we need you, Dr.
Yes,
Sherry.
she has been. Absolutely has.
Absolutely.
So the products are kind of rolling out. You've got the PMS. You've got the peri-menopause.
Menopause. Yeah.
And menopause should be out soon, correct?
No, menopause is out, and peri-menopause.
Got it right there. Yeah.
Right. What are the what's the ingredient differences between the peri-menopause and the menopause?
Mainly the collagen ingredients, the kinetine, and for wrinkles is sort of the main difference. That's not in there, because pretty much they're the same, but the collagen containing is a little less, is not in the perimenopause one.
And that's a great bonus for any woman. So there you go.
Exactly. But
we wanted to let everyone know that all the products, you can find them on our website. You can find them on your website, SHE-OLOGY. And Dr. Sherry also has several books. She's been a women's advocate for women's health for 30 years. I mean, we just think that what you do is so wonderful. And we want to thank you so much for coming on the show.
Oh, I really appreciate it. Yes. It's always great. Always great.
Yes. And just the fact that it's all natural.
Yes.
Let's do it monthly, like our period used to be.
Do that. Would you guys like that? Everybody would like that.
Don't tempt us, because we'll hold you to that.
And we do have a code on our website too for her products as well.
Yes.
So
check that out.
Yes.
What's your
thank
code?
you so much.
What's your code?
It's HF. Hot flashes, cool topic. So HFCT.
And then a 15, is it 15 or 10?
No, it's HFCT. Yeah.
Just HFCT. Okay, gotcha. Yeah.
Made it easy. I love easy ones because my brain fog kicks in. And
I know. I'm like, what number goes after that? I don't know. Yeah.
And just so everyone knows, Bridget and I did just start taking them as well. So
yes, we did, and I'm really excited.
We're walking the walk as well. Exactly.
Yes.
Thank you so much, Dr.
Thank
Sherry.
you, Dr. Sherry. Thank you.
Have a great night.
Bye.
See you soon. Okay. Bye.
Bye.